Good day, everyone. Welcome to CSA Certified Skin Authority. I'm Doc Tessa, giving you updates on the science of skincare, aesthetic dermatology, anti-aging medicine, weight loss, and laser technology. Today, we will be helping one of our clients. Her problem is excessive sweating on the armpits. So what is excessive sweating on the underarm? It is called axillary hyperhidrosis. So what are we going to do to treat this specific problem? So we will be having a patient who came to us and we will be interviewing her, ask her medical history and other backgrounds. And of course, during that, we will also be doing a so-called iodine test whereby we will determine also which part of the skin on the underarm is really sweating. And we will also show you the actual procedure that we will do to treat the excessive sweating of the underarm. So this is the so-called axillary hyperhidrosis. So watch our CSA episode on excessive sweating on the underarm.
Hi, I'm Marika de Guzman, 21 years old, from Daug, Pampanga. Currently, I'm a part-time Korean singer. Mostly mga Korean song yung mga kinakanta ko. Since this year, napansin ko parang nagpapawis na yung armpit ko almost every day. Yun yung problem ko, lagi kong pinupunasan. Nagsasabon ng antibacterial, pero bumabalik pa rin siya. Kahit anong gawin ko, bumabalik talaga siya. So, na-stress na ako kakalinis everyday, wala pa rin. Till I found out na sa CSA Derm Center, meron po silang treatment sa armpit problem tulad ng pagpapawis at pangingitim. Kaya po naisipan kong lumapit kay Dr. Contessa para masolusyonan yung problema ko sa aking armpit.
Welcome back mga kapitbahay! Atin pong pinag-uusapan ang patungkol sa axillary hyperhidrosis. So we have a patient here right now with us who had shared her problem on the excessive sweating on the underarm area. So kasama po natin si Miss Marika de Guzman. Hi Marika.
Hello po.
Okay, she's 21 years old.
Yes po.
And what do you do again, Marika?
Part-time singer.
Wow, wala bang sample dyan? Okay. And look at her, she's so pretty. She's so cute. And 21, right? Very talented. And of course, sa kanyang type of job, right? You have to look pleasing all the time. Ano pa ba? Ano pa ba yung mga requirement dyan? Being a singer.
Should be presentable,
Yes.
relaxed, and
Relaxed all the time. So, yung problem mo nga, yung ang some excessive sweating na yan,
Yes.
kailan mo pa napansin yung problem na yan?
I think po this year lang siya nag-start.
Okay.
And then, every day, parang napapansin ko po, parang lumalala na siya.
Okay.
Nagiging problem ko na po siya dahil hindi po pwede sa amin yung nagpapawis.
Oh, yeah. Kasi nga, you're an entertainer,
Yes,
so
po.
kailangan, di ba, sometimes napapataas yata
Yes.
yung armpit, and
Yes.
then pag masyadong basa na yung kasuotan, so napapansin, right?
Very conscious po kasi ako sa...
Yes. So, nung teenager ka, hindi mo pa naging problem yan. Okay lang.
Yes po, bali, nabigla na lang din po ako, biglang nag-excessive sweating na po ako.
Okay. Pero wouldn't you think na meron bang pagbabago sa iyong lifestyle? Kasi before siguro you were studying lang, no?
Yes po.
Nung time na yon, wala kang concern na ganyan.
Yes po.
Hindi kaya nag-occur yan nung nag-work ka na, ganon, change of lifestyle.
Change of food style po. I changed
Food?
from
Okay.
very healthy style.
Okay.
Lagi na po
Nahilig
ako
ka
makain
sa-
ng garlic, ganyan.
Okay. Something may mga spices ba?
Yes
May mga
po.
condiments, ganon? Mga Korean dish? Korean
Yes
food?
po.
Nahilig ka na rin? Something
Yes.
like that? Okay. Kasi considering itong problem na to, syempre marami talaga rin na individuals na ganito ang concern. The others are just nahihiya na ikonsulta. Okay? And then, syempre being an entertainer, kailangan. Wala
Yes
tong problem na to, di ba? Do you think na merong mga effect, yung halimbawa yung mga foods na nakain mo? Ganun ba yun?
I think po I got this from the garlic. Too much eating garlic.
Okay. Parang meron yata silang substance na pwedeng nag-trigger
Yes.
dun sa excessive sweating. Although, of course, in science kasi, there's really no, if you're gonna research, wala namang nagsasabi na merong scientific evidence na nagkakause directly ang pagkain sa excessive sweating. Okay? But it can be attributed kung titingnan mo, pwedeng mga genetic factors, yon pwede nating masasabi, or mga hormonal factors din. Well, stress hormones possible kasi,
Yes
di
po.
ba?
Every day I'm stressed.
Yes.
The work.
Kasi the hormones can stimulate or trigger yung mga sweat glands. Kasi yung hyperhidrosis, hyper-excessive drosis yung water, excessive sweating. Yon, doon sa axillary area. Yung iba naman mga patients ko, yung iba sa kanilang palms eh. The others naman sa feet. So yon, sa palms wala naman, sa feet wala naman.
Sa hand din po meron.
So meron, yun, may associated palang problem din sa hand area. So dapat
Yes.
din pala hand area matarget natin. Right? Well, actually here at CSA po, when we have concerns or mga problems na ganito, before we diagnose, before we proceed into any management, we do muna what we call assessment on every patient. Siyempre, ginagawa namin ng interview, history, inaalam natin kung ano yung mga past medical background niya, and considering also, when you were younger, wala ka namang medical conditions.
Yes po.
So, wala kang known any, like for example, yung mga iba kasi bata pa lang, may hypertension, tumataas ang blood sugar, or merong mga hormonal problems. So, wala kang history, plus no history na you were hospitalized. Wala, di ba? Wala pa. So far.
Yes po.
Thank God, wala pa. Okay. So, no history of mga allergies.
Since last year po, I noticed my skin gets sensitive. Very easy to get red. And
So, some people will just develop parang mga allergic dermatitis. Minsan, may nakakain, may natitrigger na mga allergic reaction. So, possible yon sa food allergies, food allergens. Some people naman may have allergies to drugs. So, do you have any allergy to any drugs? None that you know of. Kasi, when we do a treatment, for example, this one, the sweating, excessive sweating sa underarm,
Yes.
actually, the one that we will be giving you is the so-called injection ng Botox. Okay? So, before we do a procedure, we have to apply muna yung mga anesthesia, like yung lidocaine cream. Kasi may ibang tao po, allergic pala sa lidocaine. So, may mga individuals allergic sa lidocaine. So, importanteng malaman natin, do you have any history of allergies? And also for women, dapat alam natin kung kailan yung last menstrual period. Kailangan malaman natin if the lady is pregnant or not, because of course, hindi tayo pwedeng basta-basta nagbibigay ng gamot if you are planning pregnancy or a woman is pregnant, di ba? So these are procedures we do here. Definitely, it's our protocol to do an assessment po before giving any treatment, di ba? So which is very good for you also, for your own safety as well. So far, do you have any questions, Marika?
Yung procedure po, how long time siya? Masakit po ba?
Yun, common na tinatanong yan. Kasi, of course, I've mentioned, okay, ang diagnosis natin is the so-called axillary hyperhidrosis. Treatment, we will inject Botox or botulinum toxin. So, ang tanong ni Marika, yung unang tanong, gaano katagal ang procedure?
Yes.
Actually, yung procedure po, very quick lang. Madali lang naman siya, few minutes. But, by the way, before we do the actual procedure ng injection of botulinum toxin, we do a so-called iodine starch test. Yung test na yon, i-determine natin kung ano yung mga affected areas, kung saan yung merong kang excessive sweating. Later on po, we will show you yung tinatawag na iodine starch test. And, painful ba? Yung injection site, okay, we numb the skin first. Gagawin natin siyang manhid. Siyempre, lalagyan muna natin ng mga topical or ito yung mga cream na ina-apply. Pinapahid lang. This is the lidocaine cream or yung emla cream. So, magiging numb yung skin mo. Tapos, we make use of tiny injections lang naman. Tiny shots. Super duper tiny. So, it's not really that, yung wala namang masyadong discomfort. Well tolerated naman. Kayang-kaya yon, diba?
Yung how long time po maglalast yung?
Okay. According to the studies daw, okay, they were saying na generally speaking daw 4 to 6 months. But it may vary for every individual. Kasi itong type of condition that we're trying to treat is yung sa sweat glands. Okay? Kasi yung ginagawa ng gamot, binablock niya yung nagtitrigger ng excessive production of sweat from the glands. So, for some people, it may be less than 4 months. It may vary. For some, probably 3 months. It will depend on the person. And of course, it will depend dun sa amount na na-inject natin na gamot. If we were able to give the full dose of the gamot, of the Botox, then we may say it may last longer talaga. 4 to 6 months is the usual na range na sinasabi namin sa mga patients namin. Okay, for the Botox injection din kasi, we always say na ang reaction lang will be having some bruising or some hematoma. Parang bugbog lang, okay? So, yun po yung ating i-recommend kay Marika, okay, mga kapitbahay. After this, we will be showing you po kung paano ang iodine starch test to determine the affected areas of the axillary hyperhidrosis on Miss Marika. So, wag po kayong aalis mga kapitbahay. We'll be right back. We are now going to perform the so-called iodine starch test. So this is to determine which areas do we usually find excessive sweating. So our concern is the axillary area. On this part, okay, initially we will be applying an iodine, okay, or we can make use of like betadine. So this is povidone iodine. So this is one application, okay. Now, actually before we do any treatment here at CSA, we inform our patient about the procedure that will be performed. We explain to them, we in details, discuss to them paano ba yung procedure, ano ba yung mga pwede nilang i-expect, or we can answer their questions kagaya nung tanong kanina, ano ba ang mga side effects nito, ano bang mga contraindications. And with that, we ask them to sign a so-called informed consent form for every patient who will be performing or whom we will be performing a Botox. We have them sign this form, and this form will just be an indication na nauunawaan nila yung treatment and alam nila kung ano yung mga pwede nilang i-expect after the procedure at ano ba yung tina-target nitong treatment na ito. So, sa ating mga patients, sa ating mga clients, lahat po sila ay amin ding pinapa-fill up ng form po ito. And together with this, of course, they have to sign this na nauunawaan nila ano ba yung procedure at alam nila kung ano yung mga possible na mga magiging effects nito sa kanila. Okay? So, our nurse is putting on top the starch. That's why we call this iodine starch test. Yung ating starch na to, after being applied directly on top of the povidone iodine, okay, the sweat will turn the starch into a black color. So, by now po, nakikita nyo na po na merong black color that is appearing on the skin dito sa area po. So, that is the site where we have excessive sweating. So, meron po siyang mga active sweat glands. So, if we can brush off some of the starch, okay, for us to determine yung mga blackened areas, okay. We actually have a form whereby we make a drawing, then we show our patient. For example, ito kasi kung work on face area, meron din yung specific na axillary area, sa armpit area. Then, we make a drawing here saan yung affected area niya. Okay, we can actually make a dark color here. Then, after this, we put a mark kung saan po kami mag-i-inject. So, as you can see, meron na pong visible na mga darkened color. Okay. So, Marka, how are you feeling?
Painless naman.
Okay lang, no?
Yes.
So, this is yung tinatawag naming iodine starch test. So, makikita ko nga talaga. So, on your right side, right axillary area, so napapansin mo that meron ng mga nag-color black. So, if you can still remove the rest of the starch there. Kita mo yung mga borders pa lang, merong may itim.
Yes po.
So, yung sweat na yan, nag-react siya dun sa ating starch with iodine. Tinurn niya into black. Okay, so yung black na yon, dun yung may mga active sweat glands ka.
So, dun lang po siya i-inject.
So, mostly periphery eh. But I think you are experiencing yung pagsusweat mo halos dito sa may side na
Yes.
to. Okay, so yan na yung area. So nakikita po natin na meron na siyang mga nag-dark yung sa starch area, yung nalagyan na po ng starch area. So, meron namang parts na hindi naman masyadong ganun ka-dark. Okay, so yung problem mo, Marika, mostly nandito sa sides. Wala masyado sa center. Okay, ang focus ng injection natin yan sa'yo dito sa may borders. Okay. Now, we have now a gauge, we have now an indication to treat our case with the injection of the botulinum toxin. So, we're now be doing the other side, and she's been with CSA also for quite a while, for a year na, no? She has a maintained beautiful skin with CSA. Certified Skin Authority has been helping Marika to maintain her beautiful skin as well. So, she came to us, she came to me with this excessive sweating kasi nga concern niya with her type of career, being a singer and entertainer. So, let's help her out. Okay. So, right now, nakikita pa lang as we sprinkle on top the iodine starch, I mean the starch. So, you can, actually, yung left side mo, parang mas active siya. No? Look at that. Mas agad na siyang nag-black. Bilis ng pag-black. So, if we see an area which is more active, we can inject more botulinum toxin on that part. Okay. Maybe you're wondering, paano ba natitreat ng Botox yung excessive sweating, no? Ang galing naman, no? Kasi yung action kasi ng Botox, meron siyang binablock na nerve impulse papunta dun sa specific problem na yan sa sweat gland. So, hindi magpo-produce ng sweat yung gland. So, binablock ng ating Botox yung sa production ng sweat. Okay? Kaya pagka hindi ka na nagsasweat, hindi ka nagagamit ng mga deodorant, hindi ka nagagamit ng mga antiperspirant. Kasi ang isang problema sa mga antiperspirant, nagkukos ng darkening ng skin. So, yung mga may problema din na pangingitim ng underarm, most of the time, almost all cases, they were caused by use of deodorant or antiperspirant because they contain aluminum chloride that causes dark staining on the skin. So, pag hindi ka na magagamit ng deodorant or antiperspirant, of course, ang effect nito, lightening na ng skin. So, we also use this for the lightening ng ating underarms. So, this is the so-called iodine starch test, mga kapitbahay. So, wag po kayong aalis. Magbabalik ang Certified Skin Authority. Over na po. So we are now going to place markers where we will be injecting our botulinum toxin. We can do like a 1 to 2 centimeter injection mark. So there were areas that are faint, so we can actually give them minimal dose only. So focus is on this borders here. So dito tayo mas maraming injection. Okay, tsaka sa periphery. So the right axillary, an injection using gauge 30 needle. That's priming. Okay. So this is a very minimally invasive technique. Okay, injection. You okay, Marika?
Yes po.
Okay. There's no sign of any pinpoint bleeding. So comfortable. Okay. You can actually make use of an ice gel to help the area be relieved of some of the discomfort from the shots, right? And our beautiful Marika is still smiling over here. Okay? So at home, you can still do ice compress on this part, okay? By tomorrow, parang sensation lang na slight of some feeling bugbog o kaya soreness, parang ganun lang. But other than that, wala naman.
Bawal po siyang basain.
Yeah, you can just wash it tomorrow na lang. We have cleansed naman the area. Before we did the iodine starch test, the nurse already had the cleansing of the skin part, di ba? So, the good thing with the marker, it's easily removed naman eh. Okay. So, in 1 to 2 weeks, it's gonna start to take effect already. Okay?
Okay.
So let's proceed with the left side. Same thing here. Gonna do the marker again. So we're removing the lidocaine. So our beautiful Marika is so comfortable. So we have actually a white marker, so hindi siya masyadong magiging visible sa camera, but I prefer the white marker so that we can easily erase it from our client's skin. You can add more here. So one area actually we can make use of about 100 units of the Botox. Okay, so this will be injection marks, and Our client is very good. Okay. Pero you feel more of the sweating on the right side, no?
I
Or
think
it
so.
varies? Nagva-vary. We have given Marika a total of 100 units. So that's usually one vial. And she has to come back for a follow-up after 2 weeks, Marika. Meron kang work tonight?
Yes.
Or it's your day off? Day off.
It depends too.
It depends. Okay, kung merong invitation. Okay, so far meron lang mga areas na may minor hematoma lang. Then, you can continue with ice compress at home, Marika, okay?
Yes po.
So, how are you feeling, Marika?
I'm very happy now and
Yeah. Na-target natin yung concern mo. At least, ma-decrease na tong sweating. Hindi ka na yung worried na worried pag meron kang yung nasa work ka and in front of a lot of your audiences, then at least nakapag-focus ka sa singing career mo, enjoy mo lang yung pag-entertain mo, di ba? Thank you very much mga kapitbahay for watching our episode on axillary hyperhidrosis. The treatment that we have used on our client is the so-called injection of botulinum toxin or Botox. And again, we remind you mga kapitbahay na magtungo lamang po kayo sa mga certified physician na are able to perform this kind of treatment po. And beware po sa mga counterfeit Botox. And of course, be careful din po mga kapitbahay kung meron pong nag-o-offer sa inyo ng ganitong treatment. They may not be fully trained and they may not be certified. And here at CSA Certified Skin Authority, we guarantee you that our products have high quality and they were clinically tested and scientifically proven to be used and they are FDA approved. Again, mga kapitbahay, inaanyayahan po namin kayo na manatiling manood po, umabang ng aming mga episodes dito sa CSA Certified Skin Authority. Kung meron po kayong katanungan, merong mga suggestions or comments, you may email us at csaskinclinic@yahoo.com or check our website, csadermcentre.org. Maraming salamat kapitbahay. Hopefully, we'll see you again in our next week's episode. And of course, mga kapitbahay, kung meron kayong mga gustong isuggest na mga topic, again, you may email us. And our numbers, our address, they are flashed on the screen. Okay po, muli, maraming salamat. And when it comes to natural beauty, you can trust CSA Certified Skin Authority. Thank you and God bless you all.